Tonight, On Call answers questions about dealing with depression. Funding for On Call television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation. It is much more than feeling blue or sad. When you have depression, it interferes constantly with daily life and causes pain for you and those who care about you. Dealing with depression, the doctors are on call tonight.
Hello and welcome to On Call Television. Tonight our topic is about issues of mental health, but in particular about depression. Some ancient Greeks thought that to express emotion caused damage to vital organs and unbalanced the four humors. In Stoic theories, emotions were thought of as a hindrance to reason and therefore harmful to virtue. But in contrast, Aristotle believed emotions and passions were essential to virtue. More recently, one famous researcher of emotions classified emotions into 6 categories by the expressions of the face, and others made a graphic wheel of emotions grouped by positive versus negative, such as joy versus sadness, anger versus fear, trust versus distrust, and surprise versus anticipation. And the theories go on and on. Well, tonight our show is more about what Hank Williams and Bob Dylan would sing, all about those low down, dirty, rotten, worried, and sometimes lovesick blues. B.B. King did that too, you know. Tonight, you'll hear how depression presents itself in ways that are not so obvious. You'll hear from experts like Deborah Butman-Perkins, who counsels children and teenagers, from Darcy Nichols, who counsels a college student. Most importantly, though, you will hear how there is hope. You can overcome depression. There are different therapies that can be effective. It does not have to hang over you like an unrelenting gray cloud. Are you feeling the blues or worse? Do you suspect a loved one is showing signs of depression? Please ask us. We'd like your questions about depression. This is your show, so help us make it helpful to you. You may call in your questions or comments at 1-888-376-6225. You may also submit them at oncalltelevision.com and click on the questions button. Joining us in studio tonight, we have Dr. Bernie Bahnson to share in discussion and give us insight to mental health, depression specifically. And I want to ask you a little bit about where you trained. Where are you from originally?
Grew up in Sioux Falls, so I'm from South Dakota, and then did my undergraduate work at St. Olaf College in Northfield, Minnesota, and went to medical school at the University of Minnesota. And then I did a residency in psychiatry at the University of New Mexico in Albuquerque, and I did a residency in neurology at the University of Minnesota.
So that's really interesting. And you did the neurology after you did the psychiatry.
I actually did neurology first and then went back to Albuquerque and finished psychiatry.
So that's interesting because if you think they must be very, very related, but they are, I don't see psychiatrists and neurologists together except in Bernie Bahnson. I mean, do you know
Well,
of any?
Freud was a psychiatrist, and was a neurologist who ended up being one of our seminal researchers and philosophers in psychiatry, or behavioral health. So
Leading thinkers.
one of the leading thinkers, right?
Yeah. Mm-hmm. And we are joined via Skype by Rex Briggs, a clinical social worker who's been practicing in Rapid City for 35 years, the author of Transforming Anxiety, Transcending Shame. Welcome, Mr. Briggs.
Thank you very much. Good to be here.
You're from where originally, Rex?
I was born and raised in Los Angeles.
And how in the world did you get out here to South Dakota?
Well, I went to school. I was actually starting to become a pastor and went to Portland. And then I followed a baseball scholarship to Nebraska and just fell in love with the Midwest. And after I went to graduate school back in San Diego, I decided I wanted to come back to the Midwest. So I've come, and I thought I'd stay for a few years, and that was 35 years ago.
And you're out in Rapid.
I am in Rapid City.
And you wrote this book. What is the, did you write it while you were in Rapid City or somewhere along the line?
I did. I wrote it about 10 years ago, and 10, 15 years ago. And I had been working at that point for about 20 years in the field. And people kept asking, when are you going to write a book? And I kept saying, well, I'm going to do that. I'm going to do that. And then I realized I keep saying that. Why don't I just sit down and do it? Well, I kind of figured out once I started to write it why people didn't do it, because it's a lot of work. But I'm glad it's completed.
So tell us a little bit about the book.
Well, the really talks about how anxiety, it gives my own personal story. I suffered with a lot of depression and anxiety for many years, and had certainly found out about it when I was in graduate school, but I put it off. I came to Rapid City. I was still miserable, but being a therapist, I thought, well, I should be able to take care of this for myself. That didn't work. Finally, friends and colleagues suggested I get some help for myself, and reluctantly I did that. But it made such a profound difference in my life that was when I decided I wanted to give people that same sort of hope. And according to the Surgeon General at that point, we kind of estimated that there would be about probably 10 to 15 people that I would meet with. But that was about 3,000 people ago. That's all I work with, is people who suffer with anxiety and stress-related conditions, which I consider depression to be an anxiety and stress-related condition.
Boy, I totally agree with you on that. I think that if you use a medication, for example, that settles the anxiety, and you're not addressing depression, then you lose. It doesn't work. It causes problems. Bernie, do you have any comment about that?
Well, I think that depression is a neurologic problem principally, although, there are about 3 different kinds or categories of depression. There's major depression, and then there is bipolar depression, which might be an entirely different beast than unipolar or what we call major depressive disorder. And then there are all these adjustment reactions that people have as they go through life. They may have no neurochemical substrate for depression, but they're dealing with issues that make them anxious. And if you are anxious long enough, of course, you're going to get depressed. And so I agree with Rex that it kind of goes back and forth. And it turns out that the pharmacology that we have to treat mood disturbances often is effective for treating anxiety as well. So, but what we used to call the atypical depression is a person who is not particularly anxious, but they're psychomotorically retarded and slow. They can't get out of bed. They sleep excessively, and we used to treat those patients with monoamine oxidase inhibitors, which we don't use a lot anymore,
right,
but they're still available. And the thing with monoamine oxidase inhibitors is they tend to be kind of animating. Right. And so they would get these patients mobilized and out of bed. And then, of course, when you're more active, That helps to get blood pumping into your brain, activates your brain, and you start having more energy, and your mood lifts. I think also in this part of the country, where there are a lot of people with Northern European extraction,
Yes.
they're kind of obsessive people, nose to the grindstone, hardworking people, farmers that just work 24/7, and any departure from routine for those people creates more anxiety. If the departure is extended long enough, they get depressed. And then they may respond to these medications that we have for mood and anxiety.
All right, Rex, I'm going to throw that at you now. You do not prescribe medicines. I know that Bernie does, a physician, and we prescribe medications for people, and that's one way we deal. You do a lot of counseling. What is your take on medicines, and do you think that maybe we overdo them, or that or they're underused, or what's your take?
Well, according to the research, what they're finding is that the most ideal type of arrangement for people who are suffering with either anxiety or depression is that they use some medications, and they also get some training to adjust their thinking and learn some life skills so that their brain starts to work better as well. And when you have the combination of those two, things go quite smoothly. The recovery rate is very, very high. There are some people that don't want to be on medications. At one time, people thought that I was opposed to medications. I'm not. But we just have to realize what medications can and can't do. And with the types of depressions that I'm working with, along with their anxiety, it responds very, very well to some retraining, some rethinking. And once people learn to think differently, which is not as easy as it sounds, they can live a very, very robust life. Because as you were talking about, Bernie, I'm working with very ambitious, capable people, lots of teachers, lots of nurses, physicians, lawyers, people that are highly ambitious people, but they're just using their personality directly against themselves temporarily.
Yeah, that's true. People get so hung up on being type A personalities. Our society, I think, sanctifies the extrovert. And so if people are active, they stay supported by their public, but if they withdraw, then they kind of get increasingly depressed. I agree with Rex that you can change your way of thinking, and that can help your mood. And I also would suggest that medication isn't going to be the whole answer for people who have mood disturbances. We know that our medications are not perfect. You'll get a 30% response rate to a placebo that you take for depression. If you take a FDA-approved medication for depression, you get a 45% response rate. And if you take that medication for 6 months and have resolution of your symptoms, stop taking the medication, you might have as much as an 80% chance of relapsing. Whereas if you learn things like Rex is talking about, you can implement those and protect yourself from relapsing. So the combination of medications and these kind of cognitive behavioral talk therapies, I think, are the ultimate way to try to treat those conditions.
Now, people, you need to hear that the psychiatrist who prescribes medicines just said you need to have the counseling and we need to teach the behavioral things, and that the medicines help, but it's a little bit of help. It's help, but you need to do these other things. And then we just had the counselor say, well, it's not just counseling, it's medications. I mean, I love that. I love it. It must mean that that's the truth.
And the third element is that people have to get mobilized. They have to be active. And so regular exercise is paramount to having a more comfortable mood and a better way of functioning in society.
Now you're talking my language.
Yeah, well, I know you're a runner, and I'm a big supporter of distance running. So, but and it's interesting that distance runners are anxious people.
Yeah.
They're very focused. They're like the epitome of the typical South Dakotan who is nose to the grindstone. They have to stay focused, and they're nervous serious, focused people. But they do that for their own therapy.
Well, it's truly my therapy. Now, what's your thought about exercise, Rex?
I think it's absolutely essential. And one of the things that I'm talking with people about is if people can exercise and get a more healthy diet, then that is going to make a huge difference. There's serotonin in the brain change, the whole synapse issue changes, and all of a sudden our brain is producing many of the chemicals that we look to get without exercise through the medications. And once we are exercising, we may be able to reduce our need on medication. So it's a fantastic, essential part of the recovery process.
Well, the studies go on and on about the exercise as a part of this.
And the important thing to remember too is that it doesn't have to be rigorous exercise. It just has to be mobilization. These compulsive people who wake up in the morning on a Monday morning, for example, and they're facing their day or they're facing their week, it just seems overwhelming to them. And a lot of times when they're so clinically depressed, they can't get mobilized. And that's where I think the role of medication comes in. But if they are functioning at a dysthymic level, which is kind of a depression where you kind of go through your day, but you're not particularly efficient or effective or happy.
That's what dysthymic means?
That's sort of what dysthymic means. And if you talk to those people, they are able to get out of bed and go through their routine. By mid-morning, they're starting to charge up, and then they can charge through their day and get things accomplished.
All right, we have a question from Sioux Falls. Is it true to say that depression is just an imbalance of chemicals in the brain? I'd ask you first, Rex.
Well, I think that yes, absolutely. There's a clear change of chemicals. The question, and I think it's always going to be a debatable question, is what comes first, the chicken or the egg? Is the person's thinking and their lifestyle altered so that they begin to feel depressed, or do they get depressed and then their chemistry is altered? I think when I go to the national conference, they kind of have that debate that's going to be going on forever.
And I think it depends on what kind of depression you're talking about. If you talk about adjustment reaction with depressed mood, that can be a dynamic issue, where you're trying to process some conflict in your life or some stressor in your life. If you have bipolar depression, that is, to my mind, so physiologic that
physiologic meaning that is a chemical.
Well, a chemical imbalance. If it is a chemical, if the call is about an imbalance, that's what that would epitomize. Somebody who is bipolar depressed, they do not get out of bed. They are the people that are pretty at risk for suicide unless somebody makes an intervention. And increasingly, my feeling is that the pharma, the medications that we have, are not developed for bipolar depression. There are about 3 agents on the market now that promote themselves as protecting you from bipolar depression, but they don't really treat it.
So what do we have that we can to treat it?
We have ECT, which is electric shock therapy. I've had bipolar depressed people who go to bed and they don't get out, and if you don't have a backup modality like that, they don't survive. And ECT has a remarkable response rate. Same problem though, if you treat them and they get restored to their baseline, their risk for relapse after you complete a course of ECT is high. It's unless you put them on mood stabilizers, have them use cognitive behavioral therapy and exercise. So that would help to prevent relapse. And I think Rex would agree that cognitive behavioral therapy is
someone talking to you.
Talk therapy. That particular modality has quite an evidence base now to protect patients from relapse.
And the component of talk therapy is really, isn't it, that it's someone who cares and listens?
There is that component, but it's also, like Rex was talking about, it is patients who are coached on how to more realistically perceive their situation. not get it so much emotional investment in it, and take a look at it more existentially, so that they can act on it in a more realistic fashion.
Coach,
Yeah, I think that.
Rex,
Good.
here.
Yeah, if I could say something, I think that a lot of times, whether it's anxiety or depression, people become very reactive. They aren't responding to life, they're reacting to life. And in the counseling process, using some good CBT, people begin to recognize how they're catastrophizing, how they're taking things to its worst possible conclusion. And I always try and help people to understand, we're either out in the future, what ifing, and horribilizing, catastrophizing, and that makes us miserable, or we're back in our history, beating ourselves over historical types of things, and we have absolutely no excessive anxiety or depression if we stay in the present. But we very rarely stay in the present. And I've been all over the world, South Africa, Canada, Mexico, presenting, and they say that in the United States, anxiety is increasing, and so is depression, but it's increasing everywhere because our world is becoming smaller. Technology has got some very positive things, but it's got some very difficult, challenging things as well. I don't believe that we're intended to watch war on TV, and yet we do. People become more anxious. They feel more vulnerable.
You talked about cognitive, you said CBT, cognitive behavioral therapy, and you spoke to the future. And if we think about the future, we go forward with the future, we're thinking about the catastrophes that can occur. And isn't that the state of humanity, where we're the animal that thinks about the future?
It's the state of the Northern European.
Oh, is that right?
These guys who are just constantly worrying about everything.
All these Norwegians. And
all the
Germans
Germans and Norwegians and the Dutch, they're particularly worrisome. They got to keep their finger in the dike or they're all going to perish. But what Rex was talking about is living in the moment, and that's kind of what our pharmacy does too. These SSRIs, which are probably the most commonly prescribed medications for depression, are considered disinhibiting agents, and that's often what patients will complain about once they're on them. We have this nuclear structure in the front of our brains, which is called the nucleus accumbens, kind of the seat for passion. And
the seat for passion.
Yeah, and when you're young, it's like a supernova, and when you're old, it's like a little tiny flame. You don't have much motivation anymore. But the medications disinhibit patients so they can live in the moment more successfully. They don't have to worry about the future or the past. They can consider it, act on it, deal with it, but they don't get so alarmist about it.
And you're saying all of us should live in the present more.
Well, that's what Rex is saying, I think, and I think that would.
Do you agree?
I agree to a degree that it helps to attenuate the anxiety and the passion. The problem is, you want to live in the moment for your issues, but you still want to have passion, you want to have drive, and the people in South Dakota want to produce.
Right.
And so they don't like being slowed down and feeling like, I can deal with it tomorrow.
Yeah, no, I mean, if you don't put the corn seeds in the ground, you're not going to have corn in that future.
And that may be why they're built this way, because people of Northern European extraction, if they did not put the roots and berries away, their gene pool would die out because they'd perish in the winter.
Yeah. Rex, comments?
Well, I absolutely agree. I think that there's a huge difference and a significant difference between planning for the future, which we all need to do, and catastrophizing about the future. When I was in the midst of all of my worry, which is one of the significant ways that my anxiety came out, and my stomach was in uproar, I wasn't sleeping at night, I was constantly out in the future. And there's a lot of people that when they're struggling with depression, they're in their past and their history and feeling like failures. And if we can teach people to become aware of that, more mindful, and to stay more in the present, it's just extremely helpful.
Okay, now I think that's wonderful advice. It's sort of like we should all exercise but people don't generally do it. Rex, tell me, what exercise do you, what activity or what can you do to encourage people to practice this idea of living today? Not to say we're throwing away our planning and that we're not going to put the soybean and the corn in the ground, but to savor the day a little bit more. What can we do to do that?
It was actually a funny thing that happened recently that a client came in, and I'd been working with this woman for some time, and she said to me, "Have you heard anything about CBT?" And I said, we've been doing that for several years, but people, when they think about CBT, they think about simply installing belief systems into their head almost willy-nilly. And one of the things that I've found extremely helpful, I do a lecture series, a 16-week lecture series, an hour and a half each week, and people sit in on that, and then I meet with them personally to make sure that all that gets tailored to their specific needs. And as people listen to those lectures, they begin to understand their families, they begin to understand some of the ways that they have learned to think, they learn why they think that way, and we also talk a lot about learning how to utilize our emotions in the way that they're intended, making room for those emotions. So it's once you really help people to recognize and become mindful of where they came from with their thinking and some of the beliefs that they have, it helps them to change that process of thinking.
We're going to go to something shortly, but I want to catch your response to that, what he just said.
Well, I think mindfulness therapy or cognitive behavioral therapy has such a profound evidence base that it's an extremely legitimate intervention for people who are nervous or who are depressed and who are anxious. The problem, of course, is that it's expensive, to go to therapists, and it's time consuming, and people aren't willing because, in our society, you want to produce, and you don't take time out, to stay stable in your mood and your emotional health. If you can justify going to a therapist, you're going to put yourself far ahead of the game in your mental health and in your physical health.
There's a take-home message there. Play and imagination. Before I say this, I want to say, Rex, if you can stay with us, we'd like to have you hang in there. We originally thought was that Rex would go away, but we'd like to have you hang in there if that's all right.
Yeah, I'm fine with that.
Play and imagination are vital to the joys of a child's life. Using play, art, and creativity can help communicate the roots of depression for people of any age when expressing complex hurts or issues verbally is too challenging. As the Swedish proverb says, shared joy is double joy. Shared sorrow is half sorrow.
The word depressed has gotten to be used a lot in our society of, I'm having a tough day. Gosh, I'm really depressed about that. Or I'm really anxious. And I work a lot with kids and families to realize there's normal ups and downs and normal feelings of things aren't going so well. But when that leads to kind of a prevalent everyday or an often type feeling, then it's probably something that we need to look at. But I see a lot of kids and teens with anger control problems, attention problems, disorganization problems, sleep problems, not wanting to go to school. A lot of those, I'm going to show you that I'm unhappy kinds of things that kids can do. And as we work with them, then I think we could put those other labels on them. I spend a lot of time allowing kids to play out what's going on inside their head. Oftentimes, first when they initially come to see me, they don't know me or trust me. So this is a great place to get to know each other. And we have art projects, and we have puppets, and we have farm things, and I have lots of farm things because we live in South Dakota. I have many, many art things. Music, books are one of my addictions that is legal. And this is a way where kids can relax and be comfortable. And then when they let their defenses down, they can talk about things. They share a lot through their artwork. They share a lot through play. I have several dollhouses if kids are having conflict between families. I see it there. I have a sandbox behind us with many, many miniatures. And oftentimes they'll put miniatures that maybe either how they're feeling, how they'd like to feel, how it used to be. And then I can maybe go, wow, that's interesting. And that's a door opening where I can visit with them. A lot of the teenagers will do a lot of collages and artwork and drawing. And again, I might see a word here or a word there that kind of gives me an opening of, I don't believe in the fix my kid theory. I really want to work with the child, the teen, and their family. I hear you really struggling with something Dad's talking about. Can we bring Dad in? I will initially meet with the family, mom and dad and whoever is struggling, and I explain that to them and say that, gosh, sometimes we may have your brothers and sisters in here. I hear you complaining about them all the time. I wonder if mom and dad are aware of that. It's not always about that we need to get some medication, particularly with kids. So we talk a lot about relaxation and how to get out and exercise and find things that will give us joy in life again, because that's one of the things the kids talk about is nothing's fun anymore. This is one of the things that I did with a family where we had talked a lot about that it's not just the big hands that help, but that together as a family they're going to be able to solve problems. They chose this saying, and it says, if we don't look out for others, who will look out for you? Shared joy is double joy, and shared sorrow is half sorrow.
Thank you so much for that, Deb. Wonderful person who shares a love of children and plays with them and gets an insight to their what's going on in their lives and where their future is. That's so important. We would ask you to join our conversation and call in your questions and comments about tonight's topic. Call 1-888-376-6225. Or you can email them to questions@oncalltelevision.com. Anything that what Deb said strikes a chord with you, Bernie?
Well, I think children do look at play therapy and learning joy as something unique in their life if they're troubled. I think in general children benefit from structure. And that's maybe why the statistics are so high in young children and adolescents, is there's such a breakdown in structure when there aren't two parents in a family. And particularly there's not a father in a family. I think there is a good literature that suggests where there's a family or where there are children without a father figure, they're at much greater risk for developing behavioral problems. Particularly boys. And if there is a father figure there, that risk attenuates. So I think people really need to consider when they start families that they're going to make a commitment to having two parents there.
Right. Well, and working together. But the point you said was father figure. I mean, it could be an uncle, it can be a brother, it can be the new
or
father.
A mentor,
or a
somebody
mentor,
who,
a teacher, coach.
A lot of these public school systems now have mentor systems, and you have an opportunity to volunteer and go and take on some child. And they have waiting lists, students waiting for mentors. So people can take advantage of that. If we don't have families that take care of these kids, it's society's responsibility to do it. And so members of our society need to sign up and volunteer and take part.
So mentors at school systems, and it's not a waiting list. They need you.
They need you.
So
yes.
what would you do? You would have people call the grade schools and high schools?
Well, in Sioux Falls, it's Lutheran Social Services that runs that program. And I'm not sure where it is in Rapid City or some of the other smaller towns in South Dakota, but that would be the place to start.
And it should be, because the Lutherans feel the most guilt because they're the Northwestern European extraction that have all this. I'm just joking. That was just a joke. Rex, comment.
I do have an interesting statistic. Frank Pittman years ago had talked about children that come from two-parent families, even if they're not happy families, the divorce rate for children coming from two-parent families is 15%. The divorce rate for girls coming from divorced families is 45%, and for it's for boys that it's 45%, and for girls it's 4 times that high. So we really do have to do something about stability and commitment. It's been really difficult for children as they're not able to depend on the people in their life. Now, obviously, there's some places where we need to go through a divorce. We need to get away from some sort of violence. But boy, we really need to teach some very basic old school skills in communication and commitment so that we can try and make families last.
I so much agree with you. And that father figure is so important. And it's not because the mother figure is less important. Absolutely not. It's that the mother is the one who gives the unrelenting love that is always there, no matter what. The father seems to be the one that gives the structure or the rules, or the one who says, when I say no, like as my dad would say, that's it. No means no, and here are the rules that we play, and helps you with society.
Yeah, all that is true, but I think one thing the mother needs to make herself aware of is that when she and her partner decide to have a baby, that they know that it requires that structure, that family unit, to raise a healthy child. And so it isn't just because they want, this experience of parenting. It's not them, it's the kid that you have to worry about.
It's not about you.
It's not about them. It is about raising a healthy child in our society.
My wife and I actually, I'm sorry, my wife and I my wife is a teacher and has been for over 30 years. And she and I are currently writing another book, a second book, because there is a growing trend in the school system for children suffering with anxiety and depression from first through their senior year in high school. And we're trying to address some of those problems, but it's a growing thing.
I would submit that it's the issue of the value of family has been not only a political issue, it is an issue that we need to do everything that we can to encourage family life in our society, and we share help. That's the obligation I think we should do is if we're a grandparent and we see that there's trouble, we're there for them. If we see a neighbor that's in trouble with that, we can be part of that family support.
Yeah, I think the key issue or term is responsibility. If you have children, your responsibility is to provide structure for them. And if you can't do that, then somebody else has to step in. If it's an uncle or an aunt or a grandparent or society, that's our responsibility, is to launch these people in a healthy fashion so that they can go on to have healthy kids, not dysfunctional families.
Right. I'm going to go and dive into these wonderful questions that we're having. Caller from Rapid City is on 3 medications for 2 years and has not noticed much of a difference. Do you have any advice? It's bupropion, citalopram, lorazepam.
Well, it depends on the mood disturbance, of course. If it's a unipolar or major depressive disorder, there are 3 classes of antidepressants. The ones that work on serotonin, those that work on both serotonin and norepinephrine, and those that work on dopamine. Those serotonin, norepinephrine, dopamine, those are the molecules in your brain that are felt to be the neurochemical substrate for mood. And so if you, like I said earlier, the most commonly prescribed are the ones that work on serotonin. And oftentimes people will get on those medications and they will have a good response. If they don't, or if the response flags or starts to ebb, then you can add in one from a different class and see whether there's a better response.
So if you're not getting response there, Bernie's saying, talk to your doctor. I'm feeling I'm flat. Let's go in a different direction.
Yeah, you have to shake it up a little bit.
Yeah, I'm not a big fan of lorazepam for depression. What is your take for that?
Lorazepam is not an antidepressant. It's a medication for anxiety, and there is a role for that, but it's a rescue therapy principally for situational anxiety. It's not prophylactic. It doesn't protect you from getting depressed.
And I'm afraid that it, like all the benzos, might even make people more depressed. Here's a caller. Ask about 88-year-old mother who has orgasms throughout the day and night. She's unable to control them, and they affect her sleep. She's on Seroquel, and it isn't helping. Have you ever heard of this?
No, I think she needs to see an endocrinologist.
Okay, there's something else happening. A lucky lady would know,
Apparently.
probably not.
Yeah.
Rex, comments?
Well, I think that part of what we're talking about again is what we talked about earlier in the program, and that is, most of the time, because of money, people go to their doctors, and the only type of treatment they do is medication. But they found in the research that if you have medications along with some CBT types of counseling, that your chances of actually improvement are much greater. So I think that it's terribly important for this person that was in Rapid City that needs to, that just didn't seem like they were getting much help, is have they added that component?
Here's the question, Brookings, counseling with medication. Why doesn't Medicare cover counseling? It covers psychiatry for medicine, but does not cover counseling. Bernie?
Well, most of behavioral health is not covered very well, whether it's medication or counseling. Now, with the new Obamacare...
No, you went into this for the big bucks, I know. Bernie,
Yeah.
You're the...
Yeah, actually, I was just listening to a lecture about how to encourage medical students to go into behavioral health, and one of the issues is to make sure that they don't have school loans over $200,000 when they're finished with medical school, because if they do, they can't afford to go into behavioral health. They'll have to go into some subspecialty that generates more income.
That's a horrible thing. Now, the Affordable Care Act...
The Affordable Care Act supposedly is going to mandate that people are allowed some kind of disposition for behavioral health or mental health services.
There we go. So, Rex, there's hope. Diet question. You spoke of this before. You got to eat right to feel right. How does diet affect depression? Do you have any comments?
Well, diet is, I think, a part of lifestyle, and lifestyle includes, as it relates to mood, exercise and losing weight, and I think diet is part of that. So you need to get rid of highly refined sugars and just stay with meats and vegetables and
not too much of it.
Not too much of it.
And then sit around the table for supper if you absolutely can. Rex, comments?
Oh, I agree. I think that what you're just saying, Rick, is very important, that family life, once again, is critical. But, when we put carbohydrates into our body, regardless of whether they're simple or complex carbohydrates, they immediately become sugar. So we really need to be careful to put in proteins as well as healthy fats. And if we can do that, we're not going to be going on an adrenaline rush constantly. But the easiest things for us to eat, the most fun things for us to eat, unfortunately, have been carbohydrates.
Yeah.
Although, once you establish a diet that is relatively free of highly refined sugars, it's a pretty nice diet. People don't complain about it, right? But it takes you a week or two to get used, to get off the carbs. And once you go through that withdrawal, it's a lifestyle change that can serve you well for decades to come.
People like it. The studies show that they're better off with it. They feel better. Everything works better. The carbohydrates are a problem, and almost everybody in the
They're toxic.
They're toxic.
You need to get rid of them.
Get rid of all of the sweets. Here's a question about family history. Are there genetic testing, runs in families, preventive therapies?
Yeah, they're not. Behavioral health issues typically do not involve autosomal dominantly inherited conditions.
So you're not doomed if there's depression.
You're not doomed. The new catchword for nature-nurture issues is epigenetics.
Yes.
And epigenetics means that you have genes in your DNA, and if those genes are exposed to certain kinds of traumas, it will turn them on or off. And that will manifest itself later on in your behavior and in your mental health.
And your future can, the way you act can affect the future of your children.
Right.
Rex, comment?
I wouldn't know how to comment to that.
Okay.
Go ahead.
All right. Talk about magnetic treatment, carotene helpful, other herbals.
I don't know, transcranial magnetic stimulation?
I don't know, magnetic treatment.
Well, that's probably TMS, which is transcranial magnetic stimulation. That's a new modality for treating mood disturbances, and it has a certain evidence base. It's approved by the FDA, and it's a less invasive form of treating major depression than ECT. The
Electrical shock therapy. Which got a bad rep by the Who Flew Over the Cuckoo's Nest.
Yeah, but now people do it more commonly, and it's actually safer than medications. But we don't go there straight away. We try medications and therapy and exercise first.
Okay,
but
so
TMS, transcranial magnetic stimulation, is a new modality that's less invasive than ECT. The problem with it is, at this point, it's expensive. And it's a huge investment of time because it's a daily thing.
And it's early yet, man. He said it. It's less dangerous than medications. So think about that.
Right.
Electroshock therapy. Talk about depression, vitamin D. And there's these herbal supplement things. Any comment? Rex, you have any comment about
it? We really need to remember that herbs can be very powerful, but they are extremely powerful, and they are not regulated quite nearly as well as medications are. But sometimes people try and take both together, and then they get really messed up. So they really need to be careful with herbs, and knowing where to go for help with knowing what supplements to use is also a difficult thing.
I think vitamin D, investigating levels of that is probably an important thing to do.
Yeah.
And because
check your vitamin D level. Yeah.
Have your primary care doctor or your psychiatrist check your vitamin D level and see where it's at. And if it's low, then I think it's worthwhile to get on a supplement. But perhaps the better thing to do is just to get outside and get yourself exposed to sunlight.
Do both.
Yeah, do both. And that way, you're mobilizing yourself, you're perfusing your brain, your mood's going to improve.
Walk through the winter.
Yeah.
Through
Plus
the
it's
winter.
Physiologic. You're not taking all these toxins.
Yes.
Yeah.
Light therapy for depression. Rex, any comment?
Well, I just don't feel like an expert when it comes to light therapy. What would Bernie have to say about that?
I think it's critical for people who have a pattern of being depressed in the wintertime. It isn't a sufficient intervention, but it's a very good adjunct. And listeners can get online and look for light boxes because they range in price. But 20 minutes, if you have a pattern of being depressed in the fall and winter, you can get online and get a light box. Sometimes they wear visors. You have to have a certain frequency of UV light.
Hey, you're a believer.
I am a believer.
Very good.
Yeah, but the better thing is to get outside.
Hey, we'll do them both.
Yeah. Okay.
Well, we want to say thank you to Rex for sure, and don't go away, and we'll be back right after this.
The flu bug is getting ready for another season. Are you? Get vaccinated, because stopping the flu starts with you.
Suicide and depression is on the rise, especially in men. A recent report from the Minnesota notes overall suicide rates there are the highest in 20 years, showing an increase by 13% from 2010 to 2011, especially in 50 to 59-year-old men. The CDC speculates that the worldwide suicide increase in 50 to 59-year-old men is a consequence of the recent international economic crisis. Illustrating further the story of male gloom is that the highest suicide rate of all is still in white men older than 84. It's no leap to say that if suicide in men is on the rise, then so is depression. Shakespeare speaks to his own low-down blues in Sonnet 29 after the plague, close closed his theater in 1592. When, in disgrace with fortune in men's eyes, I all alone beweep my outcast state and trouble deaf heaven with my bootless cries and look upon myself and curse my fate. But I submit, if we were to ask Bill if he were depressed, he would say no. In my experience, men commonly do not admit to having depression. Instead, they express increasing anger, building stress, shortened fuse, and an intolerance of the boss, the spouse, the incompetent, the government. Sometimes they speak of loneliness, financial problems, or divorce, and then complain of back pain or stomach trouble or insomnia or a new weakness. Other times they will label themselves as post-traumatic stress disorder or even justified sadness, but only rarely will they admit to depression. A careful evaluation by an astute clinician should be the first order of business, since some of these men may have a medical problem causing this outcast state. A careful history and physical exam will sometimes reveal clues to an underlying brain or lung or kidney or heart or other condition. Following findings from the exam, it might be appropriate to order thyroid or vitamin B12 or testosterone or heavy metal levels and perhaps a sleep oxygen study, an X-ray, or a stress test. But many times, there is no medical, social, or even post-traumatic stress to cause the man to be so down. He just is. And for some undefinable reason, is at significantly higher risk for successful suicide than a woman with the same condition. Even if you are that guy cursing your fate, realize that your condition is very common, might indicate a medical problem, and will definitely get better unless you end it. Whatever this low-down blues thing is called, it is something that can be fixed without violence. Well, Bernie and Rex, we've got a couple minutes to summarize or to make sure that the take-home message is there. Rex, do you have any particular take-home message that you would like to share with the people out there?
Well, Rick, just listening to the statistics on suicide and some of your comments, it's a tragedy, and it has such terrible effects for the people left behind. Suicide is a short-term solution to a long-term solution to a short-term problem. And if you can help people to begin to feel like they have the means to attack this thing in their life, helping them to break it down into small pieces so that they can begin to believe I can, it's an incredibly empowering experience. So that's just the thing most recently on my mind after you spoke.
So, I mean, we're talking suicide. Any comments, Bernie?
I think those statistics are a reflection of our culture. I think women probably suffer just as much with depression, but they're more vocal. They use their support systems more effectively than men do. Many of those statistics reflect guys coming back from Afghanistan and the Middle East and Vietnam. And a lot of our Native Americans, where it's where alcoholism can be a huge contributor and disinhibiting agent. People need to learn not to expect so much from their lives. You know, the bar gets set so high for men to achieve these things for themselves and their families. Our culture needs to step back and say, we don't need that much stuff anymore. We need more companionship, more compatibility, and more time with family than earning things. So if that happened and we could get out of some of these military entanglements, I think the suicide rate would come down.
Right. Wow. This brings us to the end of this show this evening. I sincerely thank our studio guest, Dr. Bernie Bahnson from Sioux Falls, and Dr. Rex Briggs, Rex Briggs, who joined us via Skype from Rapid City for helping to answer all the insightful questions from our audience tonight. And we've got some more than we didn't get to. So thank you for those calls. To once again quote Shakespeare, this time from All's Well That Ends Well, there's place and means for every man alive. Until next time, stay healthy out there, people.
Funding for On-Call television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.